Hello guys, welcome to our channel RD Plastic Surgery, Hair Transplant and Laser Center. Today we are presenting a nutshell of a case which has taken a timeline of 2 years. In other words, in 1.5 minutes we are showing you what was done in 2 years. This is regarding scalp reconstruction, how we reconstruct a scalp so that ultimately the results are aesthetically good and the person can lead a normal life. This is a young patient who had a scalp tumor, and this tumor was to be removed, and we had to wait to finalize till we are sure that the tumor will not come back. So immediately we removed it and covered it with a skin graft so that we can observe the tumor recurrence anytime. So everything went okay, and the person did not have any tumor after 1 year, and being young he didn't want to have a 15 by 15 centimeter defect on his scalp, and since he had to mix socially, he wanted total reconstruction of scalp. At this time we were sure that there is no tumor recurrence, and so we proceeded to calculate and try how to reconstruct his whole hair bearing scalp. He had a non-hair bearing graft on his scalp, and which was to be removed and converted into a hair bearing so that he can move around in the society without being noticed or questioned about his scalp. So in this case we planned and put expanders. By expanders you mean these are silicone shells which are regularly inflated with the saline, so that we create 3 artificial tumors on his skull with a huge extra skin, so that at the end of the time, when we are sure that the skin is enough, we remove these expanding shells and replace and cut the skin graft and resurface the scalp with a hair bearing scalp. So that is exactly what we have done. We intermittently expanded these expanders which we had put and allowed to heal, and slowly every time we used to put in 100 ml, and once we were sure that we have reached to the capacity of the expanders and it served our purpose, we simulated it on an artificial skull and calculated that this was enough. Skin was generated. We also did a thermographic and a CT angiography to find out whether it was vascular, and we have not cut or any vessel, so that after we remove the expanders the skin remains viable. So when the decision was taken that we have expanded enough, we took him back to the theater, removed it and resurfaced after removing the graft, and immediate result and delayed satisfactory results are presented. We still are following the patient for a scar which we had created, which